Hello and welcome. You're watching One India News. My name is Pankaj Mishra, and with the new variant of COVID JN.1 making entry, needless to say, it has raised a lot of questions and what precautions and prevention should be there in place. To discuss that further, it's my honor to be joined by Dr. MC Misra, former director of All India Institute of Medical Sciences. Dr. Misra, we always speak during the times when not just the country, but at times the world also has seen the peril of COVID-19. This time, once again, JN1 is doing the rounds, and the impact is seen in once again the stations and pockets of India, including Uttar Pradesh. What is your observation about this variant? And secondly, how best it can be tackled?
Yeah, basically, Pankaj, if you look at the trajectory of these infections, which is happening this year, and it also happened last year, if you remember, during December and January, there was a Omicron variant which was prevalent at that time, and JN.1 is also a subvariant of Omicron only.
Uh-huh.
And we all know that this is a virus which we never thought that it will disappear completely. We were discussing it during COVID times also, that the
Right.
virus is going to be with us, amongst us, around us, and whenever the opportunity for virus to surface, it will, like influenza, common influenza, other respiratory viruses. Uh, Now, around the year, we get virus illnesses depending on the weather conditions. Like from June until November, mid November, we get dengue, chikungunya, uh,
Right, right.
quite widespread. This year, dengue was quite widespread all
Mm-hmm.
across India, and more so in Uttar Pradesh and other geographic areas.
Mm-hmm.
Chikungunya also, and other than those, these are named viruses, but there are
Mm-hmm.
unnamed viruses. 150 types of RNA viruses
Right.
around us. So this is not
Definitely.
surprising. Uh,
Okay.
and what I always say,
Mm-hmm.
that whatever number of cases, like so far there are almost 4,000 COVID
Right.
positive cases reported. These are only those who have been tested. There may be a large number who have not been tested.
True,
Like
true.
somebody asked me yesterday itself, should we go and get tested? I said it's up to you
Mm-hmm.
whether you want to get tested.
Or
It's
not.
not mandatory. You
Mm-hmm.
rest at home, isolate yourself, take measures to bring down your temperature if you have high temperature. It
Mm-hmm.
will settle down in 4 or 5 days, and that is what this virus is also doing. That so
Right.
far there are no reports of widespread pneumonia which
Mm-hmm.
is requiring hospitalization. There have been instances of few deaths in Kerala, in Uttar Pradesh, and Maharashtra, and other places, which
Mm-hmm.
can happen. These deaths happen as a result of common influenza also.
Right. Okay.
And we were discussing it during COVID pandemic as well, that
Mm-hmm.
prior to COVID pandemic in USA, almost
Mm-hmm.
60 to 70,000 deaths
Right.
were being reported because of influenza virus. And that is
True.
why there is a tendency in US to get a flu shot every
Right.
winter.
Absolutely.
People are recommended to have that, and they bring out a new vaccine every year. This is a quadrivalent vaccine, which is combination of four viruses. So now, or
Mm-hmm.
if we look at COVID or this variant JN.1, basically for COVID, there is no such recommendation as yet, that all of
Okay.
us who have been vaccinated, should I
Mm-hmm.
take now another dose? Then which
Right.
vaccine has it been tweaked to
Mm-hmm.
cover this JN1 also? And
The new.
it is
Mm.
supposed to skip immunity. Uh,
Okay.
dodge the immunity. That happens with large number of viruses, including this one.
Hmm.
But the illnesses have not been serious,
Right.
and hospitalizations have not increased. Of course, even prior to this surge of COVID
Hmm.
JN.1 variant, and we
Hmm.
don't know because genomic sequencing has not been done so far in that numbers in India, and that is what I think should be done, so that at
Right.
least we know what
Hmm.
variant it is
Right.
prevalent, and
Hmm.
uh, uh, and then accordingly the vaccine manufacturers must also take a call to
Hmm.
prepare some kind of a vaccine which should have multiple variants, and
Right.
it should cover more than one variant, if they
Absolutely.
are recommending every year. And this was in discussion even last year, if you remember, Pankaj,
Hmm.
that
Gigi.
this was a question we were
Hmm.
asking ourselves, we were asking the experts: do we need to get COVID vaccine every year, like
Hmm.
influenza flu shot?
Right. Repeated
But
ones.
there is no WHO recommendation on that as yet. There is no recommendation of our, basically in India, there
Hmm.
is something called INSACOG. INSACOG is a consortium, Indian SARS-CoV-2 Genomic Consortium, which is jointly initiated by Union Health Ministry and
Hmm.
Department of Biotechnology with
Okay.
CSIR and ICMR. So they have 54 laboratories to
Hmm.
monitor genomic sequencing. So we have the infrastructure and know-how to do
Hmm.
this, and that is what should be done with these surge which is happening
Right.
as of today. People should not panic. It is
Hmm.
not going to be like pandemic again.
Right.
There will be surge, as happens in every winter, because of our
Hmm.
lowered immunity in winters, and
Right.
also certain viruses thrive into this weather as well.
Hmm.
So they take advantage of our lowered immunity. And so people should avoid as
Hmm.
far as possible going into the crowds. If
Right.
they go, they must take precautions and
Hmm.
also take all the measures which have been recommended by Ayush Ministry for improving the immunity.
Hmm.
And for viruses, there is no medicine as such, but it
Right.
is symptomatic treatment. Like paracetamol is the best and safe drug to lower
Hmm.
the temperature if it is there. Consume lot of plenty of fluids, water
Hmm.
and other fluids. Some Ayurvedic kadhas they can use if they want. Some
Hmm.
use of ginger drinks
Hmm.
like that, tea, ginger tea, etc., or masala tea, whatever they like it, and
Hmm.
just take rest if they are symptomatic, and
Hmm.
maintain your nutrition and hydration. I think that
Right.
that is what is will be required.
Absolutely. But there you heard it from Dr. MC Mishra on the preventive measures that one needs to take. And also, in case of symptoms of COVID-19, the new variant that has come. But Dr. Mishra, I mean, this was one topic of discussion that whether we need to take another shot of COVID injection or some other preventive, medicine or vaccination. That is something that we needed to know from you. Also, Dr. Misra, here there's a unique pattern to it. To December or the winters is one pattern to it. Secondly, states like, say, Kerala, Uttar Pradesh, or Maharashtra. I mean, Thane itself has started to make headlines just as it did 2 years ago. Also, any particular reason why we see some surge in states like Kerala and down south?
I think it is more so to do with the travelers.
Okay.
There are a large number of migrants from Kerala to Gulf countries and
Hmm.
other parts of the world. So when
Right.
they return, naturally, and as we all know, that when we travel, we have higher chances of contracting viral illnesses from the during
Hmm.
the travel, air travel, because
Right.
of the closed environment. Although most aeroplanes nowadays they do have frequent exchange of air uh,
Hmm.
in COVID also, so the probability is low, but it is not zero. So
Right.
if one person gets the infection, naturally, that person comes into the community with the family, the chances of spread is likely. But again, I would say it is unlikely that it will happen like pandemic.
Mm-hmm.
It was happening in the pandemic when we had large number of people coming in. So there is
Mm-hmm.
no, I think, recommendation as of now to
Mm-hmm.
isolate them in some other areas. They can isolate themselves at home,
Mm-hmm.
and use of mask again has to be
Right.
re-emphasized. And I also say that it will prevent people inhaling polluted
Mm-hmm.
air also. So the
Right.
mask will help. It has a collateral advantage of
Mm-hmm.
prevent pollution in this weather, particularly in North India, when
Right.
the pollution levels are really very, very high. So I
Mm-hmm.
think use of mask has to be emphasized,
Right.
distancing, avoiding crowds, avoiding travel as far as possible.
Right.
I think these are the things which we were recommending. And again, there is a recommendation from the ministries also, state
Mm-hmm.
governments also, and WHO also has termed it as a variant of interest. They have
Right.
not yet said variant of concern.
Concern. Although
So
it starts like that only.
yeah, so I think, and it is unlikely that we will
Right.
see a kind of a wave.
Mm-hmm.
There'll be some surge, and you will
Right.
see that by 15th of January, I think things
Mm-hmm.
will
Mm-hmm.
settle down. It happened last year.
Okay.
Exactly the same Omicron variant was prevailing. At that
Mm-hmm.
time, we traveled from Delhi to USA, and
Mm-hmm.
went and came back safe. So I think
Okay.
if people have vaccinated themselves, those who have not vaccinated themselves as yet, they must take vaccine, because
Very
some
important.
protection it will give. Some people may still get this infection, but that will be of lowered severity. So I think vaccination does help, and
Mm-hmm.
whichever vaccine, our Bharat Biotech vaccine is very good. It
Mm-hmm.
is from the virus itself, attenuated virus. Even the Serum Institute vaccine is good. So
Mm-hmm.
both the vaccines are now. We know that they are at least at par with RNA vaccines, which were new, the
Right.
Pfizer and the Moderna vaccines.
Mm-hmm.
They are not inferior, rather they are little bit superior to the Bharat Biotech vaccine. So I
Right.
think that is something which people can do. We have given in India to 220 crore doses so far.
Right.
221 actually, to be precise.
So almost
220 and
mm,
crores and 67 lakhs doses have been given till date.
humongous feat achieved by the government there. Needless to say, sir. I mean, with the guidance from the medical fraternity and also leadership from the the ruling dispensation, India definitely, with such kind of population, has managed to keep it under control. एक आखिरी सवाल डॉक्टर मिश्रा आपसे मैं लेना चाहूंगा कि 2020 से लेकर अभी तक जो आंकड़े और जो एक्सपीरियंस केंद्र सरकार को और मेडिकल फ्रेटर्निटी को हुआ, उसका सही इस्तेमाल आने वाले समय में भी इसको टैकल करने के लिए किया जाता रहेगा। हमारे दर्शकों को भरोसा दिलाने के लिए कि स्थिति अनियंत्रित नहीं है और नहीं होगी अब, किस तरह से सरकार ने और राज्यों ने भी इसके लिए तैयारी कर रखी है?
ये बहुत अच्छा प्रश्न है पंकज जी। और जैसा मैं देख रहा हूँ, मैं दो तीन चैनल पे था, एक मध्य प्रदेश छत्तीसगढ़ की चैनल है, उस पे था कल
हुँ,
परसों
हुँ।
भी। तो आई थिंक मीडिया इज आल्सो प्लेइंग इट्स बिट एज इट
हुँ,
डिड
हुँ।
ड्यूरिंग द पैंडेमिक,
राइट।
creating awareness about prevention and
हुँ, हुँ।
taking measures into what individually people can do.
हुँ,
Governments are also alerting themselves, like the chief ministers are taking meetings.
हुँ।
Health
राइट।
Union Health Minister has taken the cognizance of this surge.
हुँ,
So
हुँ।
I think WHO has issued a advisory. So I think everybody is serious about it.
हुँ, हुँ।
और जो करना चाहिए, और प्रिपेयर्डनेस के लिए जहां तक है, तो हम लोगों ने जब पेंडेमिक में जिस तरह से किया, जबकि उस समय आपको याद होगा कि कितना
जी।
पेसिमिज्म था भारत के लिए पूरी दुनिया में, और क्या क्या
बिल्कुल,
लोगों ने नहीं
बिल्कुल।
प्रिडिक्ट किया था उस समय कि
ट्रू।
इतने मिलियन, इतने करोड़ केसेस हो जाएंगे, इतनी डेथ्स हो जाएंगी। बहुत नेगेटिव
हुँ,
रिपोर्टिंग
बिल्कुल।
थी। लेकिन अच्छी बात ये रही कि चाहे उसको आप कहिए कि सेंटर का भी उसमें जो मैनेजमेंट था, प्राइम मिनिस्टर लेड फ्रॉम फ्रंट.
Hmm. Right.
Like
Absolutely.
I appreciated in various articles, and also
Hmm.
the Mr. Yogi Adityanath, the way he performed as chief minister and led from front while he recovered
Hmm.
from COVID, and still he was going around in all the districts and taking
Right.
meetings until 11 o'clock at night and all that. So I think the governments, state government, central government, the people
Hmm.
themselves also
Right.
cooperated to large extent, except some where we had problems, like migrant
Hmm.
labor was a issue
Right.
from
Right.
Mumbai, from Delhi to their native places. But I think state governments responded well. At least Uttar
Hmm.
Pradesh, I can say that they responded very well. And
Yes.
beside, being the most populous state, सबसे ज्यादा
Hmm.
जनसंख्या वाला प्रदेश होने के बाद भी
जी
जो
जी.
ट्रेजेक्ट्री उत्तर प्रदेश की रही, it was much better than many other states. And
Indeed.
mortality, our mortality has been, overall mortality so far has been 1.18, which is quite acceptable, quite low,
Hmm.
despite
As
that we
come
saw what happened in Europe,
true.
Western Europe, what happened in USA, how people were dying, there were no beds, and all those things were happening
Hmm.
during the
Hmm.
pandemic. So I think from that perspective, now most institutions are in readiness. They have the requisite staff, ventilators, etc. So I think people should get reassured that if
Right.
they need, for if they don't need hospitalization, that's the best thing which will happen. अगर
Hmm.
उनको आवश्यकता होती है अस्पताल में जाने की, तो
जी
सुविधाएं हैं. और
जी.
मुझे लगता है नहीं है कि उसमें कोई समस्या
समस्या
आएगी.
आएगी. Dr. Misra, I mean, who else better than you to actually allay all the fears around the resurgence, if I may use the word in quotes, of COVID-19? And as it was known earlier also that this is going to stay and we have to learn to live with it, albeit in different forms and formats. डॉक्टर MC मिश्रा, हमसे बातचीत करने के लिए, वन इंडिया को समय देने के लिए आपका बहुत बहुत शुक्रिया. And we would love to have you more on the shows as we progress and we counter this challenge once again of COVID-19.
Thank you so much, Pankaj ji, and take care and keep away from virus as much as possible.
Sure, sir. Sure. Thank you. Best wishes, sir.
Subscribe to One India channel and never miss an update.